welcome back to my channel in English for Nursing Communication 2. I am Ruffel Manalo from the Faculty of Nursing of Pathom Rajabhat University. So this time I'm going to discuss with you about the concept of writing in nursing, part 6. So once again, this course is taught by the three of us. This is a team teaching course from the Faculty of Nursing of Pathom Rajabhat University. In this subtopic, we have 4 main objectives, and the 5th one here is the review of the concept. Each student must review the concept, and each student nurse should make or design a nurse endorsement report based on the case study that will be given to you, and we'll submit it back to the lecturer's email address after this lecture discussion. So you have to go back further, study all the details that we have discussed since in the previous video discussions, and try to understand again and again, and be specific also with the details that you're going to write in your homework. So the 5th objective of this focuses on the written nurse reports, or we call it writing handover reports or nurse endorsement reports, which is commonly mentioned or used terminology in the hospital setting. So let's discuss what is a handover report. A handover report, this is also called clinical handover in other parts of the world, wherein a transfer of professional nursing responsibility and aspects of care or group of patients to another incoming nurse on duty in the hospital. So this is how it looks like. You have there, this is just a sample. However, different hospitals, different country differs their format. However, these are the details that are included in the writing of patient's reports. We have the situation using S-bar that we have discussed in the previous videos. We have the background. Okay, so for the situation, this includes the admission date of the patient, the diagnosis, the physician. Then for the background, this includes the medical history of the patients, the allergies, okay, the code status, the current treatments, fall prevention if the patient is high risk for fall, and also restraint precautions. And actually, there's more. Okay, there is more. So we also have assessments, and assessment this includes, it could be a head-to-toe assessment or review systems. And we also have vital signs, laboratory results. We also have medications, and also there is a recommendation. So this is based on the doctor and the nurse perspective, how they perceive, how they look on the progress of the patient's condition. Does the patient gets better? Does the patient deteriorate? So recommendations is very important when you, as a nurse, make a nurse report. So this includes goals in consultations, tests, treatments, discharge needs if the patient is to be discharged from the hospital facility. And this also includes the report of the pain scale. For children, we use this emoticon, these faces here. They are called emoticons. So if there's no pain, we can ask the patient this. Okay, so they have to point. If they can talk, our pediatric or patients, young patients in the hospital, and 0, no pain, and 10 is the worst. For adults, we can also assess the pain rating scale by using numbers. So 0 means no pain, 5 is moderate, and 10 is the worst possible pain. So it's very easy. You just carry this wherever you go. You have a printed copy of this when every time you will be in the hospital as a student nurse or even when you are already a professional nurse. So, as a conclusion, writing summarizes the main points and raw ideas that are interrelated in the assessment, diagnosis, planning, implementation, and evaluation of patients using the step-by-step process. As you can see here, we have to be detailed in our outputs, especially when we make reports for the patient. So this is your practice test. Okay. So once again, at the end of the lecture discussion, you have to design a nurse endorsement report based on a case study and submit to the lecturer's email address. This is how it looks like. Okay. For the case study, I will give you a situation or scenario from this link. So we have to base our output from the scenario or situation from this link that you will later do in your homework. So this is how the format that you will be using. So for this topic, only use this format. You can write this in your iPad, in your computer, or in your lecture notes, and then you can send the copy of your output to the lecturer's email. So thank you very much. If you have any inquiries, please don't hesitate to send me an email, message me through my line or messenger. So until next time, see you. Bye.